Saving your smile. The importance of root canal treatment. Root canal treatment is a common dental procedure. It's done to save a tooth that is badly infected. The treatment focuses on the innermost part of the tooth, called the pulp. When the pulp gets infected or inflamed, a root canal is often the best way to save the tooth. Root canal treatment is important because it helps you keep your natural teeth. Losing a tooth can make it harder to eat and speak. It can also affect your self-confidence. Saving your natural tooth is always the best option. Root canal treatment makes this possible. It is a safe and effective way to treat infected teeth. Identifying the problem diagnosis and X-rays. How does your dentist know if you need a root canal? It starts with you. Tell your dentist if you have tooth pain, sensitivity to hot or cold, or swelling around a tooth. Your dentist will examine your teeth. They will also take X-rays. X-rays help the dentist see inside the tooth. They can see the pulp and check for infection. X-rays are a safe and important part of the diagnosis. They provide a clear picture of the tooth's internal structure. This helps the dentist determine the best course of treatment. Early diagnosis of an infected tooth is crucial. It allows for timely intervention and increases the chances of saving the tooth. Numbing the pain, the role of anesthesia. Before starting the root canal, your dentist will make sure you are comfortable. They will numb the area around the tooth. This is done with a local anesthetic. The anesthetic is given as a shot near the gums. It numbs the nerves in the area. You will feel a small pinch when the anesthetic is injected. Once the anesthetic takes effect, you won't feel any pain during the procedure. You may feel some pressure, but it will not be painful. Anesthesia ensures patient comfort throughout the procedure. It allows the dentist to work efficiently and effectively. Section 4. Reaching the infection. Accessing the pulp chamber. After the tooth is numb, your dentist will make a small opening. This opening is made in the top of the tooth. It allows the dentist to reach the infected pulp. The pulp is the soft tissue inside the tooth. It contains blood vessels and nerves. When the pulp is infected, it needs to be removed. The dentist uses small instruments to create the opening. They work carefully to avoid damaging the surrounding tooth structure. Accessing the pulp chamber is a crucial step in the root canal procedure. It allows the dentist to reach and remove the infected tissue. Section 5. Cleaning and shaping, removing infected pulp. Once the dentist can access the pulp chamber, they will remove the infected pulp. They use small files to clean and shape the root canals. Root canals are the small, narrow channels that run from the pulp chamber to the tip of the tooth root. They need to be thoroughly cleaned and disinfected. The dentist will irrigate the canals with an antimicrobial solution. This helps to kill any remaining bacteria. They will also smooth the canal walls to prepare them for filling. Thoroughly cleaning and shaping the canals is essential for successful root canal treatment. It removes the infection and creates space for the filling material. Section 6. Sealing the tooth. Filling with Gutta-Percha. After the canals are cleaned and shaped, the dentist will fill them. The filling material is called Gutta-Percha. Gutta-Percha is a rubber-like material. It is biocompatible, meaning it will not harm your body. The dentist heats the Gutta-Percha and uses it to seal the canals. Sealing the canals prevents bacteria from re-entering the tooth. It also helps to protect the tooth from further damage. Gutta-Percha is the gold standard for root canal fillings. Its biocompatibility and ability to seal the canals make it an ideal material. Section 7. Restoring your smile, crowns and fillings. After the root canal is complete, your tooth may need a crown or filling. This helps to protect the tooth and restore its function. A crown is a custom-made cap that covers the entire tooth. It is often recommended for teeth that have had large fillings or have been weakened by decay. A filling is used to restore a smaller portion of the tooth. Your dentist will recommend the best option for your situation. Restoring the tooth is the final step in the root canal treatment process. It ensures the tooth's longevity and functionality.